Hi there, my name is Dr. Delia Tatel and I am practicing in California, USA. Today we are going to talk about COVID-19 and oral cavity. We all know so far that our mouth is actually the gateway towards our overall health, and it's so important to understand. Right. Lately, doing my homework, trying to understand the pathology of this virus, I'm reading lots of articles, and I ran into this interesting article called High Expression of ACE2 Receptors of 2019 and CoVid on the epithelial cells of oral mucosa, published in International Journal of Oral Science in 24th of February 2020. What do we know so far is this specific COVID-19 virus loves to attach to a specific receptors called the ACE2 receptors, which stands for angiotensin converting enzyme 2. And these receptors, they do have a very wide distribution in our body. They can be found actually in our oral cavity, nose, pharynx, epiglottis, lungs, heart, digestive system, and also very important inside the vessels. So this specific virus has these spiky proteins at the surface called the S proteins, and the scientists proved that actually it's a very weak link between these S proteins to the surface bonding to the cells. Now, regarding these articles, what do I find out? What I find out about it? It's that COVID-19 loves to sit on our tongues more than loves to sit on our teeth and gingiva. So this is so important to understand because we can prevent the progression of this disease if we are going to do actually a mechanical cleaning of the tongue as well, brushing your teeth, clean your gums, brushing your tongue. And as you know, this specific virus loves to sit in the pharynx up to 4 days. So if you are going to use the hydrogen peroxide rinse, you are going to gargle, you're going to have a very good oral hygiene, you can actually prevent this pandemic and invading your body as well. Another interesting symptom is losing your sense of smell and taste, and was reported in the literature more and more lately, and it's all correlated with these ACE2 receptors on your tongue. Majority of them, they are on your tongue, and also correlated with a specific enzyme called carbonic anhydrase 6 enzyme, which is a zinc dependent enzyme, very important. So when you are deficient in zinc, you are going to have very high opening to this virus to penetrate your body. Also, when you are going to look into a more advanced cases, you do not ignore different symptoms and aspects of your tegument, of your face, because the vessels also contain these ACE2 receptors, and we are going to see more and more vasculitis, which is the inflammation of the vessels. The tip of the extremities like the nose or maybe the fingers, toes, they're going to look more bluish because we do have a high fibrosis inside the vessels. This disease is actually disease called hypercoagulability status of this disease. So we form more trombones into the vessels. Also, these trombones can be anywhere in our body as well. So do not ignore these signs, the symptoms that you have. And if you do have more questions, please follow me on Facebook, on Instagram under Kenny Lake Dental or Delia Tatel DDS. Thank you.